Hello everybody, I am Dr. Sarita Shrivastava, Consultant Medical and Hemato-Oncologist, available at Medicover Cancer Institute, High-Tech City, Hyderabad. Today we are going to talk about the common myths surrounding breast cancer. So the first myth is that many people think if they don't have a family history of breast cancer, they won't get it. The fact is, many patients diagnosed with breast cancer do not have a known family history. Many people think of breast cancer as an inherited disease. However, only 5 to 10% of breast cancer cases are because of heritable causes. That is, they are caused by abnormal change or mutation in the breast cancer gene, which is transmitted from the parents to their children. Second myth is that many people think breast cancer as contagious. In fact, breast cancer is because of abnormal growth and proliferation of cancer cells which arises in the breast and then spreads to different parts of the body. You don't catch breast cancer or transfer it to any other body. However, by being aware of the risk factors, acquiring healthy lifestyle, and following early detection methods, one can diagnose breast cancer early if at all it were to occur. Then the third myth is that use of antiperspirants or deodorants underarm causes breast cancer. However, there is no evidence of any connection between usage of antiperspirants or the occurrence of breast cancer. The fourth myth is that usage of cell phones can cause breast cancer. However, there is no evidence of any connection between cell phone usage and occurrence of breast cancer. Another myth is that people believe consumption of excess sugar can cause breast cancer. However, there is no direct evidence or any evidence of a direct link between consumption of excess sugar and occurrence of breast cancer. However, we as doctors advise to limit the intake of sugars because it is addictive and causes obesity. And obesity has been shown to cause a number of cancers, including breast cancer. So, it is better to limit the intake of sugars. Then another myth is that the incidence of breast cancer is higher in women with larger breasts. The fact is that there is no evidence of increased incidence of breast cancer in women with larger breasts, but occasionally screening for breast cancer may be difficult in women with larger breasts. But another myth is that a breast injury can cause breast cancer. However, the fact is that there is no relation between breast injury and breast cancer. So, a breast injury can lead to pain, bruising, or bleeding, which gradually heals over time. But a breast injury can sometimes mimic changes of breast cancer on imaging. So, it is important that while you undergo a mammogram, it is important that you notify your doctor if you have had a recent history of breast injury. Occasionally, a breast cancer may follow a diagnosis of breast injury only because the breast injury brought attention to a lump which was already existing. Per se, the injury hasn't caused the breast cancer. The breast cancer must have already been there. Another myth is that breast pain is a common symptom of cancer. However, the fact is that breast pain is not a usual symptom of breast cancer. The most common symptom of breast cancer is a breast lump. Be assured that even many breast lumps, if not all, are cancerous. However, any recurrent breast pain, especially in one part of the breast, should be evaluated by a trained physician. Another myth is people believe that breast cancer occurs in only middle and elderly age women. The fact is that as we age, the risk of breast cancer increases. Breast cancer is most commonly found in elderly and middle-aged women. However, no age is exempt from breast cancer. In fact, 10 to 15% of all breast cancers are found in women less than 45 years, and most often they are diagnosed in later or advanced stages. Another myth is that males do not get breast cancer, it affects only women. However, the fact is breast cancer does affect men as well. Male breast cancer comprises 1% of all the diagnosed breast cancer cases. So it is estimated that the cumulative risk of developing breast cancer in men is 1 in 1020. So the most common symptom of male breast cancer is a hard lump which is seen beneath the nipple and the areola. So it is important for males to be aware that breast cancer does exist and be aware of the screening procedures. The problem is that men carry a higher mortality than women, approximately 25% higher, because the awareness is less in men, and a lump less likely to be assumed as cancer, which results in delay in seeking treatment. Thank you.